Hi, my name is Mary Herbert, and today I will be presenting my Informatics and Nursing presentation. Today I will begin with explaining what this presentation will be about. Today I will be discussing the Nursing Sensitive Quality Indicator, or skill mix, that is in my NICU. A nursing sensitive quality indicator is a way to determine a standardized approach in evaluating nursing performance in relation to patient outcomes. The reason I chose to speak on skill mix in the NICU is because this has become a direct effect on our patient outcomes. Having knowledge deficits within the NICU due to the skill mix in this specific issue is why I will be discussing this today. New nurses should use this presentation as a resource into why investing in your education on a specialized unit is so important. I will begin with an interview I had with one of my most senior charge nurses on the unit. In an interview with one of the charge nurses of the neonatal ICU at MUSC Sean Jenkins Hospital, the topic of education was the center of attention. The issue of the decrease of education within the unit was brought to the charge nurse's attention in the interview in order to propose possible solutions. After a large majority of the senior staff on our unit left during the pandemic, the unit struggled with onboarding new nurses and providing adequate education for the specialty unit, leading to a skill mix issue. Previously, skilled nurses with 20 plus years of experience were onboarding new nurses, teaching them the ins and outs of the NICU. The main charge nurses on the unit are highly respected amongst the unit, hence why the interview was done with one of the longest standing charge nurses in order to help with the solution. This specific charge nurse, Megan, took on a project for her RN3 to help make educational tools to help the NICU and to provide less of a skill mix in the unit. In the interview, we discussed how we could reach the unit in order to better educate our new nurses with the immense skill mix the unit has now. In the interview, we also spoke about how we would involve the nurse manager on the unit to help support and rationalize ideas that may fit into our budget. After the interview was complete, we determined 2 solutions to how our education will help support the skill mix. We spoke on making tip sheets that are about one page length for important procedures and diagnosis we often see in the NICU. We also spoke with management to see if making a printout parent guide with rules and regulations would fit into our budget. The issue of education is a huge task to take on, therefore needing interdisciplinary involvement. In the interview, we decided to take into our own hands and ask the entire shared governance board to help collaborate with this issue. The shared governance consists of nursing staff, charge nurses, nurse practitioners, as well as the nurse manager. Including all of these different types of interdisciplinary teammates will help lead to a positive output, and teamwork will increase on the effort. The change theory that we wanted to imply was the change theory that consists of 3 components: a driving force, restraining forces, and equilibrium. In this scenario, the change theory is relevant and can help create an interdisciplinary solution by allowing collaboration between multiple driving forces in order to overcome restraining forces to reach equilibrium. In my interview, we determined that the charge nurse, Megan, and I would be the driving forces. Restraining factors would be possibly management in a tight budget, but we hope that we could reach a solution by involving the entire shared governance to take on this large project, hopefully diminishing costs and time. The source explains what change theory is. Incredible nursing theory site is written in the last 5 years. Leadership strategies can be directed and perceived in many different ways. This is why I included charge nurses as well as many other charge nurses on this shared governance staff. I think the most important leadership strategy is to be approachable. This strategy can also be somewhat of a coaching strategy and inspire others to be great. Inspiring others to take part in something to better themselves, like their education or their unit, helps create interdisciplinary solutions to issues like skill mix. The ways that coaching can aid in a solution is by having collaborative ideas taken into account. In the issue we are speaking about, education and skill mix within the NICU, my unit is being diminished and others are not feeling confident in their knowledge and the goal they want to achieve. We want to provide more education needed for this coaching strategy to allow our new nurses to understand the ins and outs of the NICU. This strategy of coaching others and to be leaders and improve their education is exemplified in an article that states, quote, "Leadership is an essential competency that is required in nursing practice and is also necessary to pay more attention to the development of nurses' leadership to improve safety and outcomes." Kim, 2022. The last topic that I will speak on is collaboration. To increase the collaboration on the initiative of increasing education and reducing skill mix, Megan and I have approached shared governance in our nurse manager. We hope that including 2 more interdisciplinary parts will enable us to provide better education resources moving forward. Although most of the resources can be done with little to no cost, we will propose that our unit and manager should invest in the education of the project if need be to decrease the skill mix on the unit. And a credible source from someone, an article speaks on the importance of investing into nursing education by stating, quote, "Nursing degrees demand academic and practical skills which nurses learn from contact with professional peers." Governance Plan 2019. The previous quote exemplifies learning on the job is vital for new nurses. With the lack of senior nurses on my unit, ample resources are needed to achieve adequate education in order to even the skill mix amongst NICU staff. Overall, throughout my ongoing interview with the charge nurse, we determined education was a huge role in why skill mix was such a quality indicator we needed to show attention to. Nurses can play an avid role in improving the quality indicator by addressing the knowledge deficit with their managers and superiors in order to get more resources needed to better outcomes. This concludes my presentation on skill mix in the NICU.